For people with reduced ejection fraction, that is EF less than 40%, there have been tremendous advances in the last decade in the treatment. There are 4 groups of drugs which are essential in patients with low ejection fraction. The first group of drugs are ACE inhibitors or ARNI. ACE means angiotensin converting enzyme inhibitors. So the examples are ramipril or perindopril, whereas ARNI is angiotensin receptor neprilysin inhibitor. The common example is sacubitril valsartan with the multiple trade names like Vimada. So these group of drugs are essential for improving the heart pumping as well as reversing the changes in the heart that will further worsen heart failure. The second group of drugs is called the SGLT2 inhibitors, that is sodium glucose cotransporter inhibitor. This group of drugs are useful not only for the treatment of heart failure, for multiple other ailments. Initially invented for the control of diabetes, at that time in those clinical trials it has been found that those people with diabetes treated with the SGLT2 inhibitors had a reduction of the cardiac problem also. Thus, they came into role apart from diabetes in the management of heart failure. Apart from heart failure management, they have a very important role in improving or preserving the kidney function. So, SGLT2 inhibitors have become an important drug in the armamentarium against heart failure. The third group of drugs which have been there in vogue for many years, they are called the beta blockers. Initially invented for the control of hypertension, now we use them extensively for the control of heart failure. The common examples of beta blockers are bisoprolol, metoprolol and carvedilol, which are commonly used for the treatment of heart failure. These drugs reduce the blood pressure, reduce the heart rate and thus decrease the demands of the heart or load on the heart. The final group of drugs are called the mineralocorticoid receptor antagonists, or in short MRA. The examples in this group of drugs are spironolactone, eplerenone or the newly introduced drug called finerenone. All these drugs, they reverse the structural changes in the heart that are responsible for the heart failure. So they have a cellular mechanism for improving the heart function. In addition, these drugs also reduce the worsening of kidney function. So for those people with heart failure, ACE inhibitors, SGLT2 inhibitors, beta blockers and MRA drugs are pivotal in reversing the heart failure and prolonging the survival. They also have an additional benefit on preserving the kidney function too.